It is also important to identify the target journal. You see, if you see in the field of statistics and medical science, if you do quantitative analysis, if you are working on medical data with a statistical analysis, you can go both ways, either to the medical journals or to the statistical journals. And you see, in some results, in some papers, you can go both directions, but you have to frame the paper in a different way. Because you see, if I'm writing for statisticians, I should focus on the methodology that I'm proposing. If I'm writing for the medical community, I should focus more on the results. So the way of writing the paper is important to be targeted with the audience of the journal. So it is important that you decide right away from the beginning which directions you are going. And it is also important to state clearly what we are doing. Like, this paper shows this and that. And it is important also in the beginning to prepare like the skeleton of the paper, like what are the sections, which kind of figures can we get, which kind of tables can we get. So in this way, we have a story there, and then we just have to put everything together. And of course, it's always important to do a good literature review, because you want to put your analysis and your paper in a global context. So it's important to take into attention of what was published before. You can go for Google Scholar or Mendeley or something else. And then, so you have a plan, you write a draft, you have to revise the draft. You might get feedback. It can be from your co-authors, it can be from your supervisor, from colleagues, and then you edit again. And finally, when you have a final version, you can go and submit. So, and also, you see, when we write a paper, usually we don't write from the beginning to the end. We write something in one section, something in another section. So we move between sections, because it is very difficult to write a paper starting in introduction and then go down until the conclusion. It's very rare that someone can do that. So because you get results and then you have to edit the introduction to include some literature review on that direction. So you can go back and forward, and I think that's the natural thing to do. And every time that you do a revision, you can focus on a single goal or a couple of goals. You can focus on the structure and revise the structure, then revise the grammar, then revise the style. So these are things that you can revise in each round of revisions. There are some strategies that you can consider. Sometimes I consider some of them. One idea is something called Pomodoro. Pomodoro, it says that you can work for 25 minutes focused, and then you take 5 minutes break, then you come back, and then so every 25 minutes you have a 5 minutes break, and then you repeat that. So that can help to be focused on those 25 minutes, and then have a little bit of fresh air in the other 5 minutes of the break. Something that you can do is to keep a daily writing log, like to have a kind of obligation. So today I wrote for this many minutes or this many hours and so on. So you can keep that in mind if you want to focus on that. Also, you see, we all have these smartphones everywhere, and the email notifications and the message notifications. So if you are writing, I think it is advisable that you turn off everything else, because otherwise it is very easy to get distracted. So I think that can help a lot. You can also do like, you can take like some time per day or per week and say, okay, in this time, I'm going just to write introduction, or just to write the results, something like that. And also I think it's important to have a kind of self-reward. So nothing will be perfect, but maybe you can get some rewards for progress. So for instance, when you finish the results, you can go out and have a walk or have a dinner or something. So you can reward yourself for small accomplishments. I think that will be a nice way to be more motivated. So the structure of the paper, there is the title and the abstract. Usually these are the last things to do. Then there is the introduction. Introduction is where we create the history of the paper. So the introduction, it starts broad. It says it focuses on the general objective, and then it narrows down to your specific objective, and then you have to say, okay, these people did this kind of analysis, these applied these methods, this did this did that, but this thing here no one did before, and that's what we are going to do. So that's more or less how the introduction should look like. So we have to give a general context, and then we have to say, okay, there is this gap here that no one did, so that's what we are going to do in this research, because that's just a story. Then the methods are just a description of kind of methods that we used. Results is just, what we found in our analysis. Some papers include discussions, some not, but discussion when included, it should be a kind of context in the general findings of other authors, basically to answer the question, why do our results matter in the general context? Something like that. The conclusion is just the key takeaways, and then the references are the base, the base for our study. So this is just a story that we are writing in a paper. So the abstract, it should be standalone. Standalone, it means that by reading the abstract, by reading the title of the abstract, we should know the most important things of the paper. Okay. So many people only read the abstract and the title, and they don't go through to the rest of the paper. So it is important that it is very clear and very objective. So it should have some kind of background. What is the aim? What are the methods? What are the findings? And why is it important? What are the implications? And this is a structure for a nice abstract. Then the introduction is the story. So what I just mentioned. So first we start with a broad context. Then we see, okay, these things here no one did before. We are going to do it. And then in the end, we can say what is the structure of the paper. Some people do it, some don't. It is not obligatory to say like in the next chapter, there is the materials and methods where we describe this and that. So this might be include or not, some people include it. So the methods, the idea of the methods is that we should describe them properly, because we should ensure reproducibility. So we have to write our paper in a way, or our results and methods, in a way that other people, by looking at what we wrote, they can reproduce exactly the same results if they get access to the same data. Okay, so that's very important. And we need to be precise and transparent. The results are, of course, to highlight what are the patterns, not just putting out a lot of numbers. It is better to use figures than tables usually, but say in some cases tables are essential to show some results. And then the discussion and conclusion is to interpret results and connect back what happened before in the literature. In terms of writing, I think it's important to be clear, to be active, and to be direct. So we should not have very fancy ways of writing, in my opinion, because we should make it easy to read for the other people that are going to read. In terms of writing also, we can think of a paragraph as one idea. We should not start to mix everything in the same paragraph. So it will be important to organize it in a way, because you see, when we are writing, it's not for us, it's for the people that are going to read it. Because if the people start to read our paper and it is not very clear, it is not very direct, there is a lot of mixed information, people will not continue, because there are so many alternative papers there to read. Why to read one that is not so well written? So it is important that we write for others, not for us. Okay, so it is easy for others to access. In the next couple of slides, I have here some suggestions of relating to writing. So it is important to understand the purpose of and the audience of the report or thesis or paper. As I mentioned before, if we are writing for the medical community, we have to write in a different way than for the statistical community. Or if you are writing a thesis, it is different than writing a scientific paper. So before starting writing, we have to be clear on what is the audience, what is the purpose of what we are doing. It should be clear and well organized. So that's what I mentioned before. If it is not clear structure, so the structure, if it is all messed up, people will not want to read it. The introduction is very important, what I just mentioned. We should have a story to tell people why what we are doing is new and why it is important. Literature review is very, very important for that. We should be aware of what other people did so that we can focus on that and do something, build up on that and do something different. Methodology, it should be carefully described, of course, in detail. The results and discussion, they include the findings, they include figures, tables, etc. And they should include also interpretations. And then the conclusion, which will just state the main findings and contributions of the report or thesis or paper or whatever. And it is also important to, in the end, to, usually some people do that, to give some recommendation. Because what we are doing here is, if we do quantitative analysis, we are transforming data into action. So we have the data, we take some methods, we analyze that, we get some conclusions, and then it will be important to transform those conclusions in some recommendations or implications. So that can be done also in the conclusion. Citations, it is important to follow the style that the journal requires or the template for the thesis requires. That's also important. And then, of course, it is always important to review and proofread. So when you have your final draft, it is important maybe to ask someone to read it for you or to read it again a couple of days later to check grammar, spelling, etc. That's also important because you see, if I receive a paper that I have to review or to deal with in a journal that I'm associated with, if I look to the paper and it is the grammar is not good, the spelling, the punctuation is not well written, it is very likely that it will be rejected right away. So because what I think is, if the authors did not care in writing it properly, why should we bother referees or reviewers to spend their time to revise the paper that the authors were not care about? Okay, so the writing is very important. So before submitting, please try to organize it and revise in a way that it is well written at least. Okay. And then choosing the right journal, that's what I just mentioned before. Now, in terms of the publication process, it is important to read aims and scope because often people submit papers to journals that are not so in line of what they are doing. For instance, if in your paper you don't cite a given journal, it is very likely that maybe you are not reading that journal. Maybe there is no association of what you are doing. On the other hand, if in your paper you cite 3 or 4 papers from a given journal, maybe that is a good fit for your work. Okay, so, but you can also do that by checking the recent issues and see, okay, I'm working on this kind of methodology and this kind of application. I can go to the journal website and see the last issues and see, okay, are they publishing something on this line or this is completely different? If this is something completely different, maybe we can choose another journal. Okay, and of course we should avoid predatory journals. What usually I do is I only submit papers for journals that are either on CIMAGO or on Scopus or have impact factor. Otherwise, I'm usually not submitting papers to other journals. To submit, you need usually a cover letter. In the cover letter, you have to sell your paper. You have to tell, okay, this is my contribution. This is why it is important. This is the novelty. And this is how this novelty is related with the scope of your journal. So that's a way of selling whatever you are writing, because the cover letter will be read by the editor of the journal, and that is the first stage. So when you submit a paper, it will be received by the editor or the co-editor, and then that person will decide if the paper goes through or if it is rejected right away. Okay? If the paper is not on the scope of the journal, it will be rejected right away. It is a desk rejection. If not, the editor will associate the paper with an associate editor. So the paper will be sent to the associate editor, and the associate editor can also suggest a rejection right away, or can send the paper to reviewers. Okay? If it suggests the rejection, it goes back to the editor, and the editor will make a final decision on that. If it goes to the reviewers will evaluate, will write a report, and make a suggestion. Then those suggestions are seen by the associate editor that will make a final suggestion to the editor, and the editor will decide what to do in the end. Okay, so that's more or less what happens when you submit a paper. Of course, it is important to follow the author guidelines. To be careful with the figures. Figures are very important. If I look at a paper that the figures are not well formatted, it's the same as when the text is not well written. Like if the authors did not care to write proper text or to put the proper figures, why should I bother reviewers to spend the time on analyzing it? So just try to do something that you would like to see as a reviewer. And of course, you should also, when there is the case, to include supplementary materials like data or code or whatever appendices might be useful for the readers. So that's right with peer review. So it can be single blind or double blind. Single blind, it means that the reviewer knows the name of the authors, but the authors do not know the name of the reviewer. Okay, so it is only one side. Double blind is when no one knows who is who. So the reviewer does not know who the authors are, and vice versa. Okay, and then the decisions are accept. You are happy with it. Minor revision, it means that some small things have to be adapted. So, but minor revision is on the very good way. Then major revision. Major revision, it means that there are some flaws with the paper, so they should be correct and adapt before they have a chance for a new revision. Then there is the reject and the resubmit, which means that your paper is rejected, but there is some value that they allow you to resubmit the same paper, and then reject. Okay, and I think it is important. Don't take criticism personal, because this is just a collaboration. So the reviewers are working for free in most cases, so they are just giving you suggestions. So what usually they evaluate is how original the paper is, what is the clarity, if it is clear or not, the methodology, is it relevant or not, and how important it is for the field. So those are most of the things that they evaluate. Then when you revise a paper, you have to resubmit. It is important that you highlight all the changes that were made, because you see, as a reviewer, it will be easier for me if I get a text saying, okay, this is what I comment, and this is the response from the authors. This is my comment, this is the response from the authors. And that together with highlighting the original paper with all changes. So that's usually a requirement from the journals. And then just I will just have a couple of slides. I think my time should be almost over, right? Yes, I see Paul there saying yes. So well, give me just a.
We still have 5 minutes. Yes, yeah.
No, but I can finish in maybe 2 or 3. Thank you.
Thank you so much. Yeah.
So I think what we do needs ethics. I think that's very important. So we should not do plagiarism. So we should not copy things from somewhere else. We should not do plagiarism of ourselves. So because if I'm copying part of my previous paper, that's also plagiarism of myself, but is also plagiarism. We should not fabricate data because you see that is not good for science. That's not ethical. Or let's say that I get a lot of results and I'm just reporting those that are good for my claims. This is also not an ethical way of doing things. Also, if someone did not contribute to the paper, I don't think they should be included as co-authors. So that's ghost authorship. Maybe you can, before submission, you can double check by using some plagiarism detection tool to see what happens. And of course, you should follow the rules for acknowledging funding and authorship, but this is usually described by the journals. Then, in terms of visibility and open science, so you can put things online before you submit. You can use archive or some other platforms. For data and code, you can use GitHub. Then when the paper is published, you can promote that and advertise in LinkedIn or X or blogs or something like that. And something that might be interesting is to collaborate internationally, because that will give more visibility and might bring more citations. Let me just go back to the final advice here, and then I have 2 slides that I will skip, but I will be able to share the slides then for all participants so that we don't get very delayed. So I think it is important to write regularly, because the more you write, the better you become at it. I understand that there is all these ChatGPT and generative AI tools that will make writing easy, but I think we should use these tools in a way that we are learning something out of that. So we should use it as a helper to improve the way that we write, but not to write for us. So it is important that, let's say, okay, I don't speak, I'm not a native English speaker. So I wrote a paragraph, I can ask ChatGPT to revise it for me. But just to ask ChatGPT, okay, I'm working on this field, write an introduction for me. This is not really very good. So, because you are not learning anything out of that. So I think it is better to use these generative AI tools as a kind of tutor instead of someone to do your job for you. And of course, you should look for co-authors that can complement your strengths. Imagine that you are working in biology. Maybe you need someone from statistics to help you to get some nice results, or vice versa. Rejection is part of the system. Don't be depressed if you are rejected in the beginning of your career. It is very sad, but then with time, that is just normal. So a rejection means nothing after some time. But in the beginning, I understand that mentally people get a little bit unhappy with it. I have here a couple of slides that I'm going to skip fast. Those are just 10 rules for academic writing that I mentioned already before. And I'll also put here 10 for research in general. I will leave this in my slides. So that's how I end this talk. These are my contacts, my email, my website, and then the information of my lab. And thank you very much for your attention. Anything that you would like to discuss, please feel free to write me. Paul also has my email, Olawale also. So, and thank you again for the invitation. Yes, and that's what I have to say today.
Okay. Thank you so much, Professor Rodrigues, for that enlightening and very highly practical session. And I'm really grateful for the tips you shared, about writing. And I think one of the things you reminded us about was that writing is not just a technical process; it's an ethical, it's an intellectual, and it's a creative responsibility. And just to summarize the key things, you shared was that actually science is not complete until it is really communicated. And you shared also with us how we can clearly, also communicates, our research into very quite structured also writing. And you talked about obviously the structure from introduction to conclusion, which is very key. And I think I love your organization. You can see also the actually the statistic elements in the way you presented your slides. And that is why one of the reasons for the other academics to collaborate, where obviously the medical, if we have probably a big time, grants or or research trials, it would be nice to also collaborate with very experienced also statisticians like you to guide us into those things. And I think also what also you also emphasize is writing with clarity, make it very clear, simple, active language, avoiding jargon, you said was very important. And you said something about the clarity is credibility. And you also said we should choose our journal wisely, avoid predatory journals. I think somebody just asked the question about that, and later on you'll be able to share, obviously during the question and answer process, but you also talked about references. You talked about ethical integrity, which I think is very important. And I think you also mentioned about ChatGPT, which is, I think, is something very important in these days, you understand? Because people don't know that ChatGPT can hallucinate a lot, it will just extract a lot of data, big data, a lot of, junk sometimes that people put on that. And it's very important, as you said, not to allow ChatGPT to do your writing, but rather just probably give some probably structure or probably the grammar or something, just improve your writing. And you should learn from artificial intelligence, and not that artificial intelligence will replace you. A lot of people are scared in the future, that would have, that it is possible that robots will replace humans with this time. So as Professor Rodrigues has said, it's very important for you, to not just, allow ChatGPT to do your writing, learn from it, you can, use it to edit also some of the things, but do your own thinking, your writing yourself. And the last thing I think I'm taking from what you said is all about that something paralysis, which you mentioned, which I'm trying to remember the exact word, but the key thing is that it's not blank page as a paralysis. That sometimes it's not about perfection. You have an idea, you're stuck, just start something, write it down. Okay, thank you so much, Professor Rodrigues, once again for an excellent presentation. And Professor Rodrigues will be available for also during the question and answer, to obviously answer questions. Okay, thank you so much again, all the way from Brazil. Now, without also further ado, I just want to, introduce the next speaker. And the next speaker is Professor Olawale. He is currently the president of the ADA Global Concept. And he is currently, an on-board, actually fellow at University of Education in Ludwigsburg. I can't really pronounce the German aspect of it. He is currently also a council member of the International Statistical Institute, and is one of the 10 council members. And he has, several also publications, more than 150 peer-reviewed also publication. He has, he is in the executive board of some, international statistic organization. He was a first LISA fellow, which was an interprofessional statistical also collaboration, that first premiered in the United States. So without further ado, I think his CV is quite a lot, but I think I will just also call him in, to speak with us on the statistical methods. I'm sure for us medical people, statistics is like Greek to us, and it's one of the most difficult aspects in research for us. So how can we make also statistic easy? How can we look at it as something we enjoy? So Professor Olawale Awe, who is a professor, in Germany, is here to demystify the mysteries of statistics also to us. Yeah, over to you, Professor Olawale.
Okay, thank you so much, Dr. Bolaji. And I want to thank the previous speakers, Dr. Aderinto and Professor Rodrigues. I will work together with Professor Rodrigues for some time, and we are glad that he could join us. The two previous speakers have done justice for this webinar. I just want to highlight some important statistical methods. You know, statistics is very, very important when we talk about research. In fact, is the heartbeat of research, as you will see as we go on. So I'm just going to introduce to you, we can't finish everything, but I just want to open your eyes to some of the very important aspects of statistics and probably how to choose the best statistics for your research or the best statistical method for your research. And so also I'm going to talk about some common pitfalls and some reporting standards that should be followed. Now, why do statistics matter? Why do we need statistics? Statistics is the heartbeat of research, is the art of evidence-based research. You know, there's hardly anyone, I don't know who here would say that he has not used one statistics or the other in time past during your research. You know, statistics will help you to transform your clinical observations into medical knowledge and into, of course, research. In fact, statistics is the scientific study of data. And every day, as we move about every day, we have data all around us that can be turned into research. And we make decisions every time. And we see patients, we do a lot of things in the clinic. That is data. And so you see that medical researchers are some of the most published researchers in the world. They publish a lot because they see patients. Patients come in and out. In fact, for a good, a medical researcher who really knows his onions, you should publish a lot, you should be able to publish a lot, but you need statistics to be able to publish good, credible research. So every medical decision rests on data, from diagnosis to prognosis and then treatment. And then without statistics, research becomes just some kind of anecdotal exercise, and it becomes misleading. So we need statistics to be able to quantify uncertainty in our data set, to be able to separate real effects from random variations, and to be able to generalize our findings responsibly. So from data collection to data analysis, data reporting, all that, statistics has a major role to play. So without statistics, research becomes mere opinion. And with statistics, research becomes evidence. And this is the era of evidence-based research. People want to see evidence. You know, people want to read about evidence. So statistics is important everywhere. And it's not just a side tool. it is the heartbeat, like I said, of all credible research. Now, we can also see that statistics is the language of research. Whatever type of research you are doing, there's no kind of research you say you are doing that you won't use one statistical method or the other, but people always use it wrongly. And that is why your research gets rejected. And sometimes you are not able to move forward in your research. And that's why we want to introduce you to some of these methods in our webinar series. I'm going to point out some of them today, and we're going to see how far we can go. Of course, we have learned that good research begins with a question, but how do you answer the question? Is statistical methods that will help you to answer the questions. So you see how important it is.
This one is very expensive. Not to this one. Oh, lab, lab is expensive. Very expensive.
Is it possible, Olutunde Phillips? Also, can you mute yourself, please?
Research cycle.
Yeah.
Okay.
Yeah.
So we'll see from study design to data collection, ensuring precision, to be able to reproduce your research, from analysis to interpretation without exaggeration. You need good knowledge of statistics and the right method to use. So we have been introduced to the type of research in medical, the types of medical research, from basic lab research that explores biological mechanisms, or to clinical research, which could be divided into experimental and observational. Previous speakers have talked about that. We have epidemiological research, translational health services, qualitative, even quantitative research, even implementation research. Now, all these types of research, you have to find your niche. I'm sure you are involved in one of these. Any research you undertake will be classified under one of these areas. And you need to understand the appropriate statistics useful, or the kind of method that is very, very apt, that is appropriate for your kind of research. Now, if you look again at the cycle, you will see that statistical analysis stands at the very center of the whole process. And so you need to take your statistics serious, because it is the bridge between medical research and reality. Now, in the clinic, you see patients, but in research, we want to see patterns. So statistics stands as a bridge that will allow us to ask and answer very important questions. You know, for instance, you want to know whether a new drug that was designed by an organization is really better than the existing ones, or probably can a biomarker predict disease better, or the risk of exposure of to a particular disease. You need statistical reasoning rather than mere intuition. Now, what are the various types of statistics that are available, that probably in our career we have come across? as someone with a BSc, MSc, PhD in statistics, in addition to some other degrees, we have seen or learned about these methods at various points. And for non-statisticians, people that are new to research, this is usually the area that is very problematic. And so I want to just demystify or just summarize some of these methods to you. I have up to 10 sections. I divide them into 10 sections. The very easy one is the first one, the first section, descriptive statistics, that you must have seen or used. But may I tell you that even descriptive statistics, you can use it to write a very good paper. Even mere descriptive statistics that does not involve any form of method or inference. Statistics, of course, is divided into two. We have descriptive statistics, we have inferential statistics. So descriptive statistics is the area of statistics that deals with how you talk about the characteristics of your variable. You describe your variables, you describe your data without making any inference with any model per se. Someone brought a PhD work to me some years ago, and all she needed to do was just descriptive statistics. And we used some tools, maybe like R and some other tools, statistical software, to get some to obtain some descriptive statistics. And it was looking very nice. And she went to present the results proudly. And she was able to graduate just via descriptive statistics because it was done appropriately. There are plots you need to use for some certain types of data. You don't just use bar plot for every type of data. You don't use, for instance, box plot for any type of data. It has there is a particular data that is suitable for any type of plot that you want to use. There are different plots for different data sets. Now we have the mean, median, the mode, which summarizes central tendency, try to point at the center of the data. You want to know perhaps the average blood pressure of some patients, maybe some malaria patients or some COVID-19 patients. And then you may want to know their median age. Then we have standard deviation, interquartile range, variance. They also quantify variability. They are powerful tools, but it doesn't stop there. You can also do some frequencies and percentages, because without statistics, without data analysis, the data becomes just garbage. You cannot understand anything. It's just scattered everywhere. But by the time you are able to say, out of the patients that came to that presented with a particular disease, 95% of them are feverish. Then it's beginning to make sense. That's frequencies, that's percentages. You'll be able to write better. And people that are reading, your readers, will be able to understand also better. So we have range. Range is the difference between the highest and the lowest. We have the coefficients of variation, which expresses relative dispersion of the data, is also a very powerful coefficient for knowing about variation in a data set. Then we have different types of plots: box plots, histograms, scatter plot, line graph, a lot. By the time you begin to collaborate, or you collaborate with experts, you know which plot is suitable for which data. Like I said, you cannot just use a plot, on any data. It may not be suitable. You have to know which one is suitable for comparison and which one is better. We have several spaghetti plots, violin plots, and so on and so forth. There are many, but they exist to help you analyze your data, to help you understand or describe your data better. Then correlation is also a kind of descriptive statistics. We use it for description. Some researchers do not know why correlation, or which type of correlation to use. There is a particular type of correlation for a particular type of data. If you have categorical data, there's a different type of correlation. You use PMR rank correlation. If you have continuous data, you use Pearson's correlation to determine association between your variables. Now, let me move to the second stage, another part, comparative methods. Your aim or your research question may be not just to describe your data, but to compare. After describing, you might not want to now go ahead or compare the data sets. You want to, for instance, you want to compare between two means, maybe drug A versus drug B. You want to compare effects on blood pressure. There are methods that are very pertinent to use. We have t-tests. It has its rules. It has its assumptions. We cannot cover everything now because of time. We have analysis of variance. There's also analysis of covariance to compare three group means and adjust for covariance. That's when you are bringing in covariance. Then analysis of covariance will be appropriate. For instance, we want to compare three diets on cholesterol. Then there's this popular one, the Fisher's exact test, which is also akin to the chi-square test, popularly called chi-square test. It's used to compare associations between categorical variables. When you have all categorical variables, then the chi-square test is quite appropriate for comparison. And then we have the non-parametric tests. When we talk of non-parametrics, when the assumptions of normality are not fulfilled, when your data is not normally distributed, then you go ahead and use the alternatives, which is the non-parametric test. For instance, we have the Mann-Whitney test, we have the Wilcoxon sign rank test, we have the Kruskal-Wallis test for our Friedman test for multi-group comparison. Then we have the McNeman's test for binary paired data. Most often pre and post tests, maybe pre-vaccination versus post-vaccination of patients. and then you want to test the effect of the antibody. Now, let's move ahead. If you want to go ahead beyond mere comparison, you might want to do some modeling. There are different types of modeling that are common in medical research. We have one popular one is the linear regression model. It could be simple linear regression. It could be multiple linear regression. Simple linear regression, when you have only one response dependent variable and one independent or explanatory variable. But when you have more than one explanatory variable, then you have multiple linear regression. Now, one assumption, as the name implies, is that the relationship between the dependent and independent variable is usually linear. When you plot the graph, that's why you should do some descriptives first. You plot the graph, you will see the relationship looks linear. Then you go ahead and use linear regression. Or also the assumption of normality exists. But one thing I want to let you know is that the dependent variable here must be continuous, must have continuous outcome. We also call it dependent variable. We call it outcome variable or dependent variable. So that outcome variable must be continuous in nature. Then for non-linear relationships, where we have the outcome variable, what if the outcome variable is not continuous in nature? Then you use logistic regression. For instance, most often when it is binary in nature, it could be more than binary, outcome, yes, no. Sometimes they may put the middle one there, neutral, or undecided. So you want to predict an outcome, then you are talking of logistic regression. But it also depends on the type of data that you have. What if all the data set that you have, they are mostly count data? They are sparse data sets. Then, for instance, hospital visits per year. Those are sparse, very sparse count data. You have methods like Poisson or negative binomial regression. And you can use that. It will give you better results. Then when it is a time to event data, we're talking of survivor analysis, you have methods like cost proportional hazards, accelerated failure time, mixed multi-level model, generalized estimating models. We have GAMLAS, generalized additive models with location and scale. Very interesting models that you can use, advanced model. But I want to encourage you, start from the simple ones. And there are so many methods that are available for you to use. Some researchers, they only know one method, analysis of variance or linear regression, and that's what is used in almost all their publications. No, there are a lot that you can use. Okay, then we have also diagnostic test evaluations. For instance, you may want to do some diagnostic tests. We have sensitivity analysis. We have specificity analysis, positive predictive value, negative predictive value. These are useful to determine predictive accuracies to obtain, the true negatives or true positives in some screening tests. Very, very important, especially when you're designing or when a new diagnosis test tool is being designed. Then you need to subject these to statistical analysis before it can be credible, before it can be approved for general use. So we have a receiver operating curve, which is very, very important. It combines the two measures above, sensitivity and specificity, to determine the discrimination ability. For instance, if you obtain an AUC of 87% for malaria test or for any other disease, that's good enough. The higher, the better. Then we have the likelihood ratio test to determine the diagnostic strength, and then greater than 10 is better, is good. Then we have Brown score. So many diagnostics tests. We have balanced accuracy. We have Matthews correlation coefficient. A lot of them that can be used that are very useful in clinical research. Now, what of other methods? There are so many. I told you we have methods for comparison and agreement of methods. You can get the Bland-Hartmann's plot to agree between your method, for instance, new device versus standard BP device. You can get the measurements from the old one and the new one, and then you'll be able to get the Bland-Hartmann's plot. You'll be able to see which one is better, which one should be approved for clinical use. So you can see the importance of statistics. What of for categorical inter-rater agreements? We have Cohen's kappa, which is a very powerful tool, or weighted Cohen's kappa. And we also have we have Cronbach's alpha to determine internal consistency of a tool. We have repeatability coefficient to determine precision of measurement, and so on and so forth. These are very good statistical tools that will make your research more credible. You should not limit yourself to just the known ones. You can do more research to use more important methods that could be more allow for more credibility of your research. Now, if you have multivariate, you have so many variables, you may want to reduce the dimension. There are dimensionality reduction methods that you can use, like principal component analysis, factor analysis, cluster analysis. That's already going to machine learning, K-means, hierarchical, agglomerative, and also all that. Discriminant analysis to classify subjects, and we use cluster analysis to group similar objects or patients together. The result comes out very beautifully. And then we can also use maneuver multivariate analysis of variance and multivariate analysis of covariance, then canonical correlation, and so on and so forth. Now, let me look at other areas. I know Dr. Aderinto talked about this one. We have meta-analysis. You want to combine study results, which is very common among medical researchers. In fact, there are a lot of papers you can write. There are areas that have not been researched. You can do a meta-analysis of this, either fixed or random, using forest plots to visualize full effects or to detect publication bias, using funnel plots. Then there's also what is called network meta-analysis. This is useful for comparing multiple interventions. For instance, could be multi-drug hypertension therapies. Time will not permit me to talk more about this. We hope that we'll be having more regular webinars to really, really help our people to understand these methods. This exercise started because we see that a lot of our researchers or upcoming scholars, they need to know more about research, and we want to give back to the society. We want to help them to really publish well, so that especially in developing countries, or some of our people that came from developing countries to the developed world, they need to catch up with what exists. So we want to serve as a bridge so that we can really do thorough job, collaborating and helping ourselves to move on. Now we have cumulative meta-analysis, also systematic reviews, narrative reviews, and all that. Now we have experimental design and sampling, randomization, blocking, power and sample size estimation, factorial design, cluster randomized design, adaptive Bayesian design. These are very, very important methods that are useful. I'm going to share this slide. We also have some other modern methods for causal inference, or for instance, propensity score matching, inverse probability weighing, to adjust. All these are to adjust for selection bias, to determine selection bias, and to balance confounders in our variables. Now we have instrumental variable analysis. We have also structural equation model, mediation, moderation analysis. These are very powerful, new, modern methods that are very interesting. And then we come to the last one, machine learning and AI methods. We have the supervised machine learning and unsupervised machine learning method. We have popular models like decision trees, random forest, which is random forest is a correlation of several decision trees for nonlinear classification, for prediction. Then we have support vector machines. We have neural network, deep learning methods, lasso and read methods, which are also good for prediction and also for feature selection. They do the two together. They help you reduce your variables, and they also give you the best predictors. Then we have Bayesian models, which incorporates prior knowledge. And we have explainable AI, which is one of the new areas of machine learning. We wrote a paper, several papers about this recently. I just wrote one about a few weeks ago, very interesting, and is gaining more citations. Now, this helps us to explain risk factors in prediction or predictive models. Now, I know the time is up. I think we have to stop here. I've outlined something here. This is self-explanatory. If you want to choose which method to use, you cannot ask, how then do I know which method to use? This is a kind of guideline to really select the best method to use. In the past, when people come to me as a statistician, say, I want to analyze this data, and they will even tell you the method they want to use. It's like a doctor that is coming, a patient coming to a doctor and telling the doctor, this is the drug I want to use. No, it's not so. There are guidelines for selecting the best method to use. So when using all these methods, avoid confusing statistical reports with clinical significance. Most times they complement each other. And don't ignore assumptions like normality, linearity, independence, and so on. And don't overfit your model with too many predictors, and avoid selective reporting and publication bias. There are several transparency and reporting ethics that are available now. There are so many standards, consolidated standard for randomized trials, and so on, for the one for epidemiological observational studies, and so on. Please keep abreast with them and report well. Ethics is a very serious matter. Now, always report effect size, confidence interval, your exact sample size. Don't just say data were collected. What is the sample size? And how did you undo the data? Now, we have seen that statistics is very important. We hope that as we move on, we will be able to learn more about these statistical methods. You don't get all in a day. It's gradual. You have to have a niche, and you will get there. It's not just about curiosity or clarity, but careful consideration, careful analysis. So a good research begins with good measurements, and good measurements begins with good statistics. So I want to leave it here for now. If you have more questions, I hope we will create a great community and we'll be able to learn more about these methods in the coming months. Thank you very much for listening.
Thank you so much, Professor Ware, for that very brilliant, talk on actually medical statistics made easy. And I think also for us, obviously, a statistic for us clinicians, statistic is one of our weakest link. And it's good that you actually displayed, those various also statistical methods. And I do think us knowing or learning statistics is not going to happen, in a day. And I think that's why the ADA Global also concept, is plans to do this webinar monthly, in order to go through those models. But it's not just also going through those models. You want, us to bring ideas, and then we can use those statistical models to generate really impactful research. And so thank you so much. And I think just also before I go to the panelists, and I think one of the things actually gained from what you said is that, statistics is a bridge between is a bridge between ideas and patterns. It's not just ideas alone. It's not just having curiosity. It is not just writing a paper very clear, as as Professor Rodrigues has emphasized. It's not just only the academic writing, but how valid is the result. And it is only choosing the right statistical method that would show the validity of any result. So a big also thank you once again, the president of ADA Global Academic, professor, of machine learning and statistics all the way from Germany. Thank you so much for that very good speech. So we move over now to the panelists, which we do have Professor Rodrigues, Professor Olawale, and Dr. Aderinto. I know our time is running, so we have like a bit of, let me say, around 10 minutes also to just, answer the questions. I think the first question here also that I see is for Professor Rodrigues. What are predatory journals? I think somebody made a question. What are predatory journals?
What are? The question is, what are?
Yes.
So predatory journals are, well, there are many definitions for that. I think that some definitions are biased because of where the journals are coming from. In my opinion, a predatory journal are those that write you an email saying, send your paper, we'll publish in 1 week for $500. This is a predatory journal. I'd not associate journals that charge article processing charges as a predatory, because if we do that, Nature will be a predatory journal. So I don't think it is related to the publishers. It is, well, it is this broad case that send your paper, we'll publish in 1 week. This is predatory. Even if you pay or you don't pay, if they promise that they will publish your paper without even looking at it, it has to be predatory. It cannot be otherwise.
Okay, thank you so much. Yeah, I do agree. I also get a lot of emails, especially if you've actually published before. You have a lot of emails, spams. Okay, you want them to publish, and after a while they'll be asking for a huge money, to
yes,
publish. So, okay, thank you so much.
And always. So let me just compliment. Always check, like in the impact factor list or in the CMAG or somewhere, if the journal is there. If it is not there, you have to doubt more. Of course, it might be a new journal, is not yet there, but pay attention to how old it is, if it is in one of these indexes or not. So based on that, you can try to make your mind.
Okay, thank you so much. Another question for you, Professor Rodrigues. How does writing a thesis differ from a research publication?
Can you repeat? Sorry, maybe I should read it here.
Yeah, he's asking, how does writing a thesis like probably a master's thesis, a PhD thesis, differ from a research publication?
For publication, yes. So it is, the way of writing is very different, because you see, when you write a thesis, a master or PhD thesis, you write with a lot more detail. If you are writing a scientific paper for a statistical journal, you don't need to write so much detail, because the readers of those journals already know the basic concepts, so you don't have to write those. So I think it is different in that sense. So the journal paper, usually it is like between 10 and 14 or 15 pages, depending on the paper and journal. And the thesis is like, I don't know, 80 or 100 pages. So the thesis is more detailed, is for a different kind of audience. The journal is for a more target audience. So it is more straight to the point and more technical, let's say.
Wonderful. Thank you so much for the clarity in answering the question. And it shows obviously that, as you've shown in your speech about being clear, I think your response was very clear. Thank you so much, Professor Rodrigues. Somebody is asking about also, just for, and I think it's for everyone. I think it will be for the president of ADA Global Academy. I think somebody is interested in knowing more about data analysis. Obviously, with those various statistics you've presented, and I think, a lot of people are quite very intimidated and overwhelmed. And it's saying, how do we need to have any special study, to know about this analysis, or can we learn by gaining experience by writing paper. And I do think that that's why we have the ADA Global Academy. It is, I don't know if you can respond to that, Professor Ware.
Okay, so you have to learn, follow a process. Number one, don't rush it. Start from somewhere and begin to learn, and that's why we said there are various webinars that will be pushing forward. You need to really be available and be serious with learning. As time goes on, you will be an expert. But don't worry if you're not an expert now. Just start from somewhere and begin to learn. Then one more thing I must say is that you have to have a niche. You can't know everything at once. Which type of research is important for you now? Which one are you doing now? Why don't you start from there and then move forward? Then you can transition into other areas, but be good at something and then move up to other areas.
Wonderful. Thank you so much. And that's why I think the ADA Global Academy from next month will be also releasing some webinar series, and we have very good faculty, Professor Rodrigues, and a lot of other, very astute, professors and quite experienced in statistics. And I think one of the goals here is obviously for us to get educated, because as a medical doctor, you can just be fixated on being a very good clinician, but we want, obviously to understand, how to turn ideas into evidence. And I think it's very important, even from a case report, although it's a very weak evidence, but it's part of it is adding data, to the medical community. And we think obviously with the collaboration with you, with the, with great statisticians, we can work together, not just learning, but also learning by experience. I think one of the objective of ADA is to also support people's ideas. If you have ideas, if you want to, you're thinking of a randomized control trials, and you need the right method. If you have systematic review, meta-analysis, you want support with that. And I think ADA is also happy to collaborate to support with that. So I think it's an exciting time for us. And I think there's also another very good question from Ibrahim, also, that said that what's also common methodological errors do researchers make that usually lead to the thesis rejection or weak also publication outcomes? I think this will be for Professor Rodrigues. What's errors from your experience, and I'm sure you would have been an editor of a lot or probably a peer reviewer. What methodological errors do researchers make that leads to their paper being rejected? And the second question is, how can we now integrate the mixed method, in thesis to strengthen reward public health insight? I think we'll just take the first one first. What's common from your experience, Professor Rodrigues? What's actually common errors in the methodology do researchers make?
Yeah, thank you for the question.
Okay.
You see, when we submit a paper to a journal, to a scientific journal, it is expected there is some novelty. Okay, so it should be novelty in terms of methodology, but it can also be, if it is a very nice application with new insights, it can also be publishable. So if you just take a standard technique, a standard method people use, and then you apply it to a standard data set, that is probably not publishable material. So I think in terms of errors, I cannot recall exactly a specific error, but I think some misunderstandings maybe. So if you want to publish a nice paper, you should have some nice methodology, not just methodology that already exists, and you should have a nice application. So, for instance, to my students, usually when we do application in something about Brazil, sometimes they come and say, okay, I want to do this analysis in my city, in this small city somewhere in Brazil. And I tell them, you see, people don't know this city. So it is better if you do a broader application in data from many cities in Brazil, like the whole country. So because it should be interesting for people that read the paper, not just for the very local community, and also for the journal to get more attention to that paper. So I don't see really a methodological error or something like that. It's more that we should be conscious that we either have a very strong proposal for methodology, I'm thinking about statistical journals maybe, or we should have a very nice application. It can be with existing methodology, but we should have a nice applications. Now, how to integrate mixed methods? I think it depends. I'm more familiar with quantitative methods, so I'm not familiar with qualitative analysis. But I do know that many journals, maybe not so much in statistics, but in fields of application, they consider papers in both cases, like the quantitative and the qualitative. That's of course very important.
Okay, thank you so much, Professor Rodrigues, for that clarity. I think there's another question. Yeah, it looks as if a lot of the questions are for Professor Rodrigues. Yeah, and what are the ethical and authorship principles one must follow when publishing with supervisors or co-investigators?
Well, this is a very tricky question. Thanks for that. You see, I think the most important is communicating with the supervisors to see what are the expectations. So yes, and I think it depends on the kind of agreement that you make with them. So usually the supervisors, if they are like doing active supervision, they are part of the list of authors. What is expected is that the person that writes the paper, that usually it is the student or the candidate for the PhD or for the master, that person should be the first author, in my point of view, but it might change from place to place. Some people do alphabetic order. I don't agree with that, but some people like it. For me, it does not make sense. So the person that writes the paper, in my opinion, should be the first author. Usually, the last author is the project leader, like your main supervisor. He might want to be the last author in the list of authors. But I think the most important is that you discuss this with the supervisors, so that you don't want to submit a paper that you have been working with them without them as knowing or as co-author. So the better is to discuss with them, have an open conversation, say, okay, I have this doubt, we are working on this paper, I don't know what to do. I heard that I'm writing the paper, I should be the first author. What do you think about this? And how should we organize the discussions and everything? So I think the best way is to talk with them without making a decision, because it might create difficult situations for the students, for the candidate.
Okay, thank you so much. I think there are a lot of also questions and we don't have time. I just want to ask Jane. Jane is raising her hands up for a while.
Yes, thank you, Paul. I have a few questions. One is for Dr. Nicholas. For narrative review, he mentioned that narrative review is not as strict as systematic reviews. So I wanted to ask, if I'm doing a narrative review, should I use a Prisma guideline? And again, how many papers is recommended minimum for a narrative review? Then for either Prof or two of them are professors anyways. I want to ask, yes, I want to ask, he mentioned that if you tell your statistician the method you want to use, like telling the doctor what medication, what management, line of management they should use for you. If you're doing a program, you are expected to send a proposal, and your proposal should have statistical method that you want to use. So at what point should we consult our statistician? Is it before, because your proposal is actually outlining what statistics you're going to use, the method actually? So should we start, or rather, what advice is he giving us? When should we consult a statistician? Is it at the point of proposal writing or when you have started already? Thank you.
At the point of
Fantastic,
proposal
Jane.
writing, let me just answer that, right?
Okay.
Yes, sir.
Okay.
At the point of proposal writing, at the very beginning.
Okay, sir.
Yes, because if you want to go to doctor, you go to the doctor from the very beginning. You
Okay.
start having the symptoms.
Okay, sir.
Yeah.
Thank you, sir. Thank you very much, sir. Thank you.
Okay. Thank you, Jen. So you go to the doctor when you have a symptom, not after the complication.
Yeah, that's right.
So
That's
you go to
right.
it means you go to the statistician even before when you start writing your proposal. I would think, just sharing ideas and they'll be able to guide you into how to do it. Because I think methodology, as Professor Ware said, doing the right method is very important for the validity of a result. And the question to Dr. Aderinto from Jane. Jane wanted to know, the differences obviously between narrative review and systematic review, and if you still need to use a Prisma as a guidelines for narrative review. And the third question was how many articles actually do you need to review if you're doing a narrative review? How many? What does it mean? From your experience, from 150 plus peer reviewed also publications. So, and just share with us.
Yeah, thank you for the question. Yes, in theory, you don't need to follow the Prisma guideline for a narrative review. The Prisma guideline was basically developed I think it was first published in 2018 by Page et al. For systematic review. But in practice, these days, when you submit even narrative reviews to journal, you see reviewers and editor asking you for things like the Prisma flowchart, how did you come about even the papers that you used? And then some of them want the methodology is almost as detailed as that of a systematic review. It's at the junction where I even advise people to move away from writing narrative review now, because you're almost giving the same level of expected to give the same level of thought line to what is demanded for a systematic review. Some reviewers will even ask you to do quality appraisers for even studies in narrative review, which is also expected in systematic review. So the lines are quite blurry now. So you should still follow it. They still want sort of an IMRAD process, your introduction, your methodology, your result. Your result is where you discuss what you saw in the literature and things like that. So yes, I think you should follow it as much as possible. That's what I'm going to say. In theory, in what we know, but in practice, you get your papers rejected if you don't follow some of this, because reviewers are actually moving towards that. In terms of the number of papers, there is no good standard number of papers really, but I usually would tell people 6-10 papers, and they should be original studies. Obviously, you can be doing review of a review. It's not, except you are doing things like an umbrella review, whereby you're just looking at systematic reviews that have been published about a particular topic, or a scoping review. But if you are doing a literature review, you should be looking at what has the original studies been done. So I think that would be my answer. In theory, yes, narrative review looks like it gives you a lot of room, but from my experiences interacting back and forth with reviewers, sincerely, they are demanding almost the same level of rigor and methodological strength that is demanded from systematic review. In terms of number, I will usually say you should have at least 6 papers. Always good if you have more than 10 original papers around that topic that you want to explore. Thank you.
Thank you very much.
Yeah, okay. Thank you so much, Dr. Aderinto, for that very explicit answers to the question. Fumi, Dr. Ware has a question.
Yeah, so hello. Thank you so much, Dr. Aderinto. Thank you so much, Dr. Paul, and all the presenters. I just wanted to give a little contribution to the last question. That the narrative review does not need a Prisma flow. However, but most good journals would reject a narrative review most times, not because it doesn't have a prisma flow, because it's not a very good evidence for whatever we are studying. Okay, so if you want to have a very good paper, you need to go for a more in-depth analysis, like a systematic review. But if you did a scoping review, you would need a prisma flow diagram. So in practice, it will be rejected if it's not a systematic review most times, because they need a very high level, in-depth study for your paper to show some level of innovations. So that's probably why it would be rejected, not because it doesn't have a prisma flow, but because it's a narrative review. It's weak evidence for whatever.
Thank you so much, Dr. Fumiawe, who also happens to be the vice president of the ADA Global Academy, also has a PhD in artificial intelligence, and gynecology. So thank you so much for the insightful response to, the answers. And in my own view, is that a narrative review is a truth about my opinion, and systematic review is the truth about this subject. So systematic review is much evidence-based, is rigor, but a narrative review, just what are some of the truths about my opinion about this, and that's it. So okay, I think we're 20 minutes also past 6 now, and I really want to thank all the speakers, for a very great session. I want to thank first and foremost Professor Rodrigues, all the way from Brazil, for a very excellent, speech about, academic writing and tips. I want to thank Professor Olawale Awe for his, the demystification, of statistics in medicine, and his insight into the right method we should be using. I want to thank also Dr. Aderinto for his very, very lucid presentation on how we can start from a light bulb ideas, from asking questions, to research. And so going forward, I think also before I allow the president also to give a speech, is that I think we already have a community in the HADA, in the WhatsApp group. And I think the community is for everyone to collaborate. If you have brilliant ideas that you want to write a proposal, you want to write, you have a grant, or you want to do a proposal writing, and you want to be sure your methods are right, we have this fantastic also panel that can support those things. And secondly, also beyond the collaboration, is also an opportunity for us to learn more about research writing. And these experts, and several other people, will be, from next month, we'll be doing a monthly webinar, just especially with specific also topics on medical research writing. And the aim is not just going to be theoretical, from what I discussed with the president. After the theory, after the teaching, everybody will be divided into breakout rooms where you bring your ideas, and from that, you will write papers. And then it's not just you writing papers, there will be also collaboration with the best minds possible. So if you have questions that you think is very difficult, this is an academy where they can turn ideas into evidence-based medicine. So I'll hand over to the president, Professor Olawale, to just talk briefly about what ADA Global Academy is. And I think there will be a link also to their website to see how you can harness, some of the materials they have, or some of the courses. Okay, over to you, also Professor Awe.
Thank you so much, Dr. Paul. We have 2 Pauls here today, great people. I want to thank you for this excellent moderation of this webinar. And I want to also thank my very good friend, Professor Rodrigues, for his time. These are very great people. We are lucky to have them. And also Dr. Aderinto. So glad that we are giving back to the society. We are giving knowledge, and that is what we stand for. So I really appreciate all the speakers, excellent speakers. I really gained from their talks. And I want to say that this is not the last. We have more programs. We belong to the other global academic community. You can join our WhatsApp, you can visit our website for more upcoming programs. And we are also connected with several organizations where you can collaborate. For instance, we saw Paulo is the president of International Association for Statistical Computing presently. And we also have several people. We were in the Netherlands about last week or so. I spoke with some people. They agreed to come and talk to this community. And we have great people that would want to share experience with this community that we are trying to gather. We want you to also join these associations. You'll be able to learn from the best and collaborate and join conferences, attend conferences, join people of like minds to do great works. So I want to encourage you to keep attending our webinars. We have a lot to come from where all this came from. So thank you for coming today. And I want to wish you the very best in your research career. Research is very important, and I'm sure you will like it as we work together. Thank you for coming. Have a nice evening.
And you too. Thank you so much, Professor.
Thank you, Dr. Paul. Thank you.
Feel free to network, to take emails, to take contacts. Also, Professor Rodrigues, Professor Awe, and Dr. Aderinto has left their email, so please kindly contact them. Look at the other websites, join the WhatsApp group, and let's build a community of interprofessional collaboration. Let's provide solutions to the greatest medical problems. We've always, it can be stroke recovery, it can be cancer research. Let's work together with the best minds, and see how we can solve medical problems. And I think ADA Global Academy is a future for that. Thank you so much. Bye.
Bye, everyone. Thank you, Paulo. Have a nice evening. Thanks, Paulo. Bye, everyone.
Bye.
Bye.